All right, well, thanks everyone for joining today. This is a webinar being hosted by Hatch, Egg Donation Surrogacy, and our partner clinic, Pacific Fertility Center, Los Angeles. And today we're going to be talking about the cost of surrogacy and how to afford the surrogacy journey. Just a quick agenda. We have just introduction to the folks that will be speaking today on the call. Then we'll give a short introduction to who we are, Hatch and PFCLA. I'll walk you through what the costs are involved in surrogacy, including really the variable or unexpected costs that can occur during the journey. And then we'll talk briefly about Hatch's fixed fee pricing structure that addresses a lot of those issues in the surrogacy process. And then I'll hand it over to Angela with our financing partner, Sunfish, who will talk to you who Sunfish is, how they help bars through the process, and then the both of us can answer any questions that we have about the process. Just as a quick introduction as to who I am, my name is Greg Wiles. I'm the president and CFO of Hatch Egg Donation and Surrogacy. My husband and I actually were also grateful and honored to be able to have a child with our surrogate Heather in Texas back in September. So we have a 7-month-old daughter for the process, and we're actually working with her on our second here. Hopefully very soon we'll have a confirmed pregnancy. So that's a little bit about me, and I'll hand it over to my co-host, Angela.
Hi, everyone. Thank you so much for having me. I'm Angela, co-founder and CEO of Sunfish. I've spent many years working in the assisted reproduction and surrogacy world, and several years ago started working on financial solutions since this process is expensive. So we'll talk you through all of the different resources that are available, how to plan, and specifically Sunfish does partner with Hatch to offer loans and a number of financial resources as you move forward. So looking forward to going through all of this.
Thanks, Angela. And then also we have on the phone Yale Scott, who's one of our intended parent coordinators at Hatch. If you guys want to speak more about what would be next steps in pursuing the surrogacy process, Yale can help you through that. His contact information will be here at the end of the process, at the end of the presentation. So let's just briefly talk about who we are real quick, because we have two logos up there. It might be a little confusing to folks. So Hatch Egg Donation Surrogacy is the agency. And for those that are less familiar with how the process works, what the agency does is it really helps you with all the non-medical aspects of the journey, effectively helping to introduce you to your donor if you need one and your surrogate, and then helping coordinate everything between you and those individuals, and then also the clinic that you work with in terms of the nurses, the doctors, and the medical aspects of it. The agency also helps you with any legal aspects, insurance aspects, and really just general coordination. Pacific Fertility Center Los Angeles is our partner clinic that's based in the city of Los Angeles, as is implied in the name, and that's really the medical aspects, right? So any fertility journey, anything involving nurses, doctors, whether you're going through a traditional fertility journey or whether you're working with a third party, a donor or surrogate, it's where all your embryos will be created, stored, and eventually transferred into your surrogate at the appropriate time. So just to kind of clarify what those two are. Talking about each one in turn, because while we brought the two companies together 5 years ago to offer a fully integrated product, they each have their own history and their teams that do specific functions, as we just discussed. So Hatch was the nation's first egg donor program back in 1991 and one of the first surrogacy programs. So we've been around for 33 years, and we've helped 8,000 intended parents in your position right now become parents through our donors and our surrogates. Over the many years, we've helped folks from 52 countries. So those of you joining us from abroad, we have deep international experience, and we work with some of the nation's leading attorneys. We don't actually have lawyers in-house. We believe the best reproductive lawyers have their own independent law practices, and we work with really all of them in the space. And the last thing that makes Hatch different than other agencies is very unusually, we are partnered with a clinic, which doesn't mean that you have to work with our clinic on your fertility journey if you're not, or you have one, you have a doctor identified. But the advantages of having an in-house clinic is that we can bring medical rigor to an agency process that historically has not had that. And so our chief medical officer, Dr. Viken Sahakian, who's been doing surrogacy for 30 years, he is reviewing the medical records of our surrogates as they're being screened to make sure they meet his rigorous standards as an IVF physician. But in addition to that, we're able to perform surrogate uterine lining checks and perform mock cycles for our surrogates prior to match to ensure that they are excellent candidates for the surrogacy process. And we're the only agency that is able to do that prior to matching. So we have lower rematch rates and higher success rates overall. PFCLA, our partner clinic, similar history, been around for 30 years and very early on has specialized in the area of third-party reproduction. And that's because California historically had the most favorable laws when it came to surrogacy fertility. To this day, over half of what we do is surrogacy, and we've helped 13,000 people become parents at our clinic with our 6 double board certified physicians. All of them have work on more than 24 surrogacy cases every year. So each one of our physicians has deep experience in this area. And our success rates, as you'll see reported in the National SART database, are 40% higher than the national average. So just a little bit of background of who we are and why we're here speaking with you today. So let's talk briefly about what financial resources are required to complete a surrogacy journey. So at a high level, having a child via surrogacy is very expensive, as many of you probably know. Having a single child, if you require an egg donor, surrogacy and IVF will cost between $180,000 and $250,000, maybe about $25,000 less if you are not working with a donor. Your second child, regardless, will cost about $120,000 to $170,000. And we're going to walk through in detail how that all breaks out between each piece of the process and how everything adds up to be that much. But suffice to say, it takes a lot of money. For those of you that live in California or in most US states, and particularly abroad, most health insurance won't cover the surrogacy portion of this. Certainly not the surrogate, and also many pieces of the IVF process required to work with a surrogate aren't covered, even though you might have what's called fertility coverage or fertility benefits at your job. And the Sunfish team can really help you break that all apart with that, and Angela will talk more about that later. There are some programs out there through your employer that do cover more. Carrot and Progeny are good examples of employer programs where they've decided to give you more benefits than a typical health insurer. And those can be great because they're really blanket reimbursements, or they're good for the clinics. That a lot of clinics take these programs like Progeny. And so these can cover a more substantial portion of it, but they still won't cover the medical portion of IVF for surrogacy that you'll still have to cover on your own. There are some opportunities out there for discount programs and pro bono journeys. Men having babies is probably the best resource for that, for those of you that are men out there, gay couples or single men. But unless you are very, very low income, you don't tend to see a lot of opportunities for pro bono journeys. So you might get 10,000 off, 15,000 off here and there, but you're not going to get a substantial portion of that through a discount program. The best source really is Sunfish and providers like that can really offer you a substantial loan, unsecured loan, that can help get you most of the way to that. But as you probably see from all of these line items, it's a cobbling together, right? It's taking some from here, taking some from there. No one solution is going to get you all the way there. Where we see a lot of people get the money for this journey beyond their savings, of course, which I haven't mentioned yet, but of course you could save the old-fashioned way, like my husband did for 5 years. We saved every penny we could and put it towards our surrogacy journey, is parents. A lot of folks would like to have grandkids, and so this is a way for them to get grandkids, and so we see a lot of that. People also rely on their homes, like home equity lines of credit. And again, the Sunfish team can really help you think through all the pieces of this and how they fit together with your ability to pay, because don't forget that it does cost a little bit of money to raise a child too. You have to be able to pay afterwards. So my only piece of advice as someone who's seen many people go through this journey is, as much as you may be allergic to this, make a spreadsheet, think about all the places where you might get the money from, and then make sure that you have the financial resources to pay for this journey before jumping in. Because the thing we most hate to see are when people begin the journey, they get partway through it, and then they have to stop because they don't have the financial resources required. And life happens, but you should know from day one where you expect to get the money from to pay for this. So let's then talk about how this all adds up, right? How do you actually get to this $200,000 in cost? So there are 3 main pieces to this. 2 if you don't require a donor, which is the surrogate, the donor, and then the IVF process, the medical process to bring them together to help you create a child. So on the surrogacy side, that's your most expensive portion of it. It's going to be between $130,000 and $170,000 all in. And the main part of this, of course, as you would expect, would be the compensation that goes to the surrogate. In the US, that averages about $60,000, which includes base compensation, and then also things called allowances like childcare, household cleaning, and other things that they need to take advantage of during the pregnancy so that they can both, a lot of them are working moms, but then also help have this baby for you. The agency, so the agency like us at Hatch that helps you arrange the match and that manages your journey for you and coordinates it from the beginning all the way to the very end, is about $35,000 plus or minus. And you're basically paying for the team at the agency to help run the process for you from beginning to end. If you decide to undertake an independent journey where you find a surrogate on, let's say, Facebook or some other place, and you guys arrange a situation together, you'll avoid having to pay that agency fee, but then you'll have to incur other costs elsewhere, and you may not have as smooth of a journey because you're doing this for the first time together. Legal expenses, and this is where you'd spend more if you didn't have an agency working with you, are going to be about $15,000. This covers the contract with the surrogate. It covers her attorney, your attorney, and then all the court costs and other paperwork necessary to establish you as the legal parent of the child. Health and life insurance, and we'll get into this here in a second a little more, highly variable, averages about $15,000, but could be as low as $5,000, it could be as high as $35,000. That's a big variable cost, but you will have to pay for her health insurance during the course of the journey. And then there are other costs, including travel of the surrogate back and forth to the clinic for her procedures, lost wages while she's not working, while she's doing all the things for the pregnancy, including post-birth, will have to be compensated by you, and various other small expenses will add up to about $15,000. So that's the bulk of the cost, between $130,000 and $170,000. On the donor side, it's a lot lower cost if you require working with an egg donor. We're talking about $25,000 to $30,000. About $10,000 is average donor compensation, but that can go very high. There's a very long tail of donors out there that went to Stanford and are runway models and that charge $100,000 for their eggs, but the majority cluster around that $10,000 area. The agency to arrange the match for you and manage it for you will be about $10,000 to $12,000 is what we see on average out there right now. Legal expenses are much lower because the contracts are far more boilerplate in egg donation, but still about $2,000. And then you'll also incur travel, escrow, and some other expenses too. That'll add up about $5,000. The IVF portion is what you're paying to the medical clinic. This will include initial screening and testing. There are lots of FDA requirements around surrogacy that have to be paid for. So a lot of testing will take place initially. Then you have your embryo creation and what's called PGTA testing, which is a requirement actually of embryos at hatch, that we do genetic testing on the embryos to determine the embryos most likely to miscarry so that you transfer normal, chromosomal normal embryos. Also enables you to determine gender if you're not familiar with the PGT testing. Then you have your embryo transfer cost, which tends to be about $5,000, medications for the donor and the surrogate, and then pregnancy care. Post transfer, usually the IVF facility will cover pregnancy care up to 10 weeks, and then after that, the surrogate's medical insurance will kick in and her OB will take over. So when you add those three pieces up, as you see, there's a lot of variability between them. There are more expensive clinics, there are cheaper clinics. There are more expensive agencies, there are less expensive agencies, right? So there can be quite a bit of variability there, but for most of these, you'll tend to know what the costs are going to be up front. But that's not always the case. In some cases, there are expenses that are variable or unexpected. And so that's what I want to talk about today, because when I first joined Hatch 4 years ago, I had a dozen friends who had gone through this process. And I asked them when I joined the company, like, so what was your experience? And I think probably like 10 of 12 hated it for some reason. And the main reasons that people hated it were a few reasons. One, they said it was super complicated. I had to work with like 5 different entities. I wish someone could have simplified the whole thing for me. The second complaint I heard was no one could tell me how much this was going to cost up front. Like I just gave you huge ranges, right? But like, what am I saving for? What's my nugget? And then the third complaint I heard from my friends was anytime something went wrong, I had to pay more money. And so it just felt like I was being nickeled and dimed the entire time up until the birth of my child. And so core to 2 of those complaints are these variable or unexpected costs. So in traditional surrogacy journeys, you sort of pay these as you go along. And a lot of these are estimates based upon what we know about the surrogate, who she is, where she lives. So let's talk about the key variable expenses. The first one is maternity health insurance. So you legally, in the contract, have to maintain maternity health insurance for the surrogate throughout the pregnancy and post-birth in case there are any complications. Now, if you're lucky, she has a health insurance policy already through herself, her employer, her husband, or partner, and you can actually get on the policy. It's a surrogacy-friendly policy, which they do exist, and it is somewhat common to enable you to be able to use her maternity health insurance for surrogacy, but it's not always. So that's like the lowest cost. And that's where you'll see $6,000, $7,000, $8,000 in terms of the low end of health insurance. Then the other situation is she doesn't have health insurance, or it's not a surrogacy friendly policy, in which case you have to place a health plan for her. Now, thanks to the brilliant individuals who devised our healthcare insurance system in the United States, you can't get her a health insurance plan outside of her employer unless you use the Obamacare exchanges, ACA plans. Those open enrollment periods are in November and December, starting for January coverage. And so if your surrogacy timeline falls in that, then we're talking like $15,000 to $20,000 of total all-in costs with an ACA plan, premiums, and out-of-pocket maximums. However, if you're starting your pregnancy, let's say in March, April, or May, you have to get a special Lloyd's of London plan through a couple of insurance providers that we have in the space. That can cost upwards of $35,000. And so it can get very expensive, which may cause some people to delay their journey to wait or not want to work with a surrogate that doesn't have a health insurance plan. So it adds a lot of complication to the journey. It's very difficult to deal with health insurance, and it can be highly variable in terms of its costs. On top of that, if you live in the state of California, there's a pesky little thing we have in California called a lien. A lien is basically the insurance company says, well, you can do a surrogacy on our plan, but we're going to put a lien on the surrogate's compensation to compensate us for all the costs that we know you're going to incur, because that's not our patient, right? You're not our patient. And so they take a lien. That can vary. It can be as little as $15,000, it can be as much as $50,000. And so these liens can add a substantial amount of cost if you're working with a California surrogate. We hope this doesn't spread much beyond the state of California, but it can introduce a lot of unexpected costs into the journey. You would know about it up front, but still, it's a big pill to swallow. Lost wages. So contractually, you must compensate the surrogate for her lost wages when she is doing something for your surrogacy for 3 to 6 weeks post-birth. And then, of course, if any doctor-mandated bed rest comes into play, which can happen quite frequently in pregnancies, you will have to pay for her lost wages. If she is a homemaker and doesn't have lost wages, great, it'll be a lot cheaper. But also her partner gets compensated lost wages post-birth and for things like the transfer, because sometimes her partner will take time off work to come with her. So that's highly variable, depends upon what her job is. Her job might be, again, homemaker and be $0. She might be an obstetrician. We have an obstetrician who's a surrogate in our program because she just loves to help people. Those lost wages can get very expensive. And so there can be a lot of variability there. A lot of it depends on basically who she is and what her job is. Travel costs are variable. They're location-based. If your surrogate does not live within driving distance of your clinic, she will have to travel to the clinic at least twice for her screening and then for her first transfer. If you need subsequent transfers, then you'll add on more travel costs. That includes flight, hotel, and per diem for her and her partner. If the surrogate is experienced, so let's just step back for a second. Every surrogate in the United States has to have gone through a pregnancy herself. So in any agency, in order to work with them, you have to have a successful own pregnancy, uncomplicated, and given birth. However, sometimes intended parents like to work with an experienced surrogate. That means someone who's gone through a surrogacy before. Those surrogates will charge more money on their compensation. And so that can be as little as $5,000, but sometimes it can be upwards of $40,000 if they've done it 4 or 5 times, in which case they will command a higher compensation. If she's willing to carry twins, that will incur more compensation. Surrogates will demand more money for twin compensation, can vary between $10,000 and $25,000. Again, this is seen far less frequently now because there are very few doctors in the United States who are willing to do a double embryo transfer. But in the event that your doctor is willing to do that and that the surrogate is, she will get more compensation for that journey. C-section, if she has to go through a C-section, there is compensation for the time and the pain and suffering of that. Usually it's around $3,000 negotiated between you and the surrogate, whether that's planned or unplanned. So, right, if you know she's going to have a C-section, you know that's an expense. But if it's an unplanned C-section, you'll be responsible for additional costs. Post-birth, a lot of surrogates agree to do breast milk pumping and to ship it to their intended parents for the first, say, 3, sometimes 6, maybe longer months. You'll compensate her for that, usually between $300 and $500 a week. And then finally, for those of you that live outside the United States, your child does not have health insurance when they're born. In the US, again, brilliant healthcare system, your baby needs to have some sort of health insurance or you pay the hospital costs. If there is a, let's say, NICU stay as a result of a preterm delivery or other reason, you would be responsible for potentially tens of thousands, if not hundreds of thousands of dollars of hospital costs. And so most intended parents from abroad will place a newborn insurance policy for 3 months post-birth. those tend to run between $10,000 and $15,000. Again, this is unique to folks who live outside the United States. If you live in the US, your child will just go on your own health insurance policy. So those are variable expenses, and there are many. I'm probably missing some, but those are the main ones. That's known up front. So most of these, except for the C-section, are really known that you're going to incur them up front. What we want to talk about are unexpected costs. So unexpected costs are costs that you haven't planned for, but they happen. We're talking about human biology. We cannot control everything. And despite all the screening that is done of surrogates, all the review of medical records, all the blood tests, there is going to be multiple transfers. There might be a miscarriage. And then there can be even more extreme situations like terminations that are medically necessary, or even stillbirths. And in those situations, the longer you go in the pregnancy, the more expensive it gets. An additional transfer for a second or third transfer of your embryo is going to cost between $5,000 and $13,000. She gets compensated for another cycle. The medications cost about $1,000 for another cycle, and then the clinic tends to charge between $5,000 and $7,000 for an additional transfer. So that will be an additional cost if your first embryo does not succeed. If you end up with a miscarriage sometime between, let's say, 8 and 12 weeks, it's very unfortunate. It still does happen with PGT testing. You would have to pay the surrogate some additional monies that you already earned for the pregnancy, and of course, an additional transfer and all the costs related to that. If we get to like 20 weeks, and it does happen very rarely, but we do have situations where we need to do terminations at that point in time, or it's a late-term miscarriage, which can happen in 20 to 24 weeks, that will incur something closer to $40,000 of additional costs that you would incur in that situation to, again, refill the surrogate's escrow account with her new compensation for another journey, or it's a new surrogate, and that's where we get to the rematch part of it, right? So if your surrogate is medically disqualified for whatever reason, either as a result of the pregnancy, or she pulls out of the process after a miscarriage, or there's any reason that's within the surrogate's control, or that's the doctor says is not appropriate, you will incur a lot of money. If it's an agency that has a free rematch policy, then you may not incur anything. But at some agencies, you'll have to pay additional agency fees. You'll have to pay for a new legal contract with a new surrogate, additional screening costs. We can talk about like maybe $30,000 of additional costs if you need to rematch with the surrogate. So when you're looking at agencies, really focus on the rematch clauses, because even though it only happens about 25% of the time overall in the industry, if it does hit you, it can end up incurring a lot of costs. So anyway, that's a long-winded way of explaining all this. I am even more long-winded in a blog post I wrote about all these expenses. Here's a link to it. And again, we're going to send this to you guys after the webinar, so you can go to that. But I go into pretty excruciating detail about each of these, so you can understand what the costs are and what the potential range of outcomes is. So my last thing I'm going to talk about today is just how we do things at Hatch, and our partner clinic, PFCLA. So given all of that, we thought that was ridiculous. And we're like, this is too much. Why can't we just insure everyone for all of those things? And that's what we've done. So we have a program. It's a fixed fee program that covers everything. And the fixed fee covers you for all the contingencies and variable costs we just described. So whether surrogate's health insurance ends up being $6,000 or $35,000, we cover it. Whatever her lost wages are, we cover it. Whatever her travel expenses are, if she needs a C-section, we cover the compensation for that. And on the medical side, we cover all the transfers you will need till you get to a live birth. We do completely free rematching, and we cover your PGTA testing, medications, and other things at the clinic. And so the idea behind our programs, in fact, if you work with an egg donor, our guaranteed birth plan will actually guarantee you the birth of a child no matter what happens in your journey. And it's really unfortunate when it happens. We just recently had a 24-week miscarriage, and those intended parents were devastated. The surrogate was devastated, but fortunately, they don't incur any more costs for redoing the pregnancy. We have a cheaper single retrieval plan that covers a single egg retrieval from a single egg donor, which 90% of the time will get you a baby. It's just a slightly more cost-effective plan for those that are cobbling together the money to pay for this. But again, that will be the maximum you will ever pay because we cover all contingencies. And for those of you who are not working with PFCLA, don't need a donor, or have an outside clinic where you have embryos ready right now, that's our fixed fee surrogacy plan. But same philosophy, which is everything related to the surrogacy from beginning to end is covered, including unlimited transfers and including rematching. And you would just pay the medical costs to your clinic for that portion of the journey. So anyway, I don't want to get too much into it. These pricing is on our website. You can take a look there. And Yale, my team member on the phone, if you guys want to talk more about these programs, can speak with you in more granular detail about how it works and review contracts with you. But I just wanted to give you a sense of how we've gone about solving for this. And then the great news is that when you decide that you're ready to start and you know exactly what you have to pay for this because our program has the exact amount you need to spend, then you can reach out to Angela and her team at Sunfish and talk about how you're going to afford this. So with that, I'll hand it over to Angela.
Thank you so much. So as I mentioned, I'm going to talk you through all the financial resources that are available. Thank you for that great overview of all the different costs. So obviously there's a lot that needs to come into play. The good news is there's a lot of resources out there. We'll talk you through all of them. If you do need some additional support, you can apply for financing for a loan. And there's also a number of other financial resources that can help you get started. So I will cover all of that. We can go to the next page. The way we like to think about financial planning is there's actually 7 different tools in your toolkit. And good news for Hatch intended parents, if you're working with Hatch or considering Hatch, we actually will offer a complimentary financial consultation to help you personally kind of go through this toolkit for you. Also, a lot of this information is on our website if you wanted to explore that on your own. But we really like to talk you through the planning side, cost reduction, and then if you need additional help, financial solutions. And on planning, there's a couple different tools you can use. Greg's blog post is a great resource to understand all the costs. We also have a cost calculator. We always advise to start by looking at any benefits you might have, employer benefits or insurance. And a lot of times that's a little bit hard to find or to navigate. So definitely if you are at a larger company or have an HR team, reach out to them. And if your company doesn't currently offer fertility benefits, tell them that you're interested. The number one reason that employers will start to offer these benefits will be because employees ask. And they're typically, we'll see between $5,000 to maybe $50,000 in benefits, but it will really vary. Insurance benefits, that's a little trickier for surrogacy. In most cases, if you do have any sort of medical insurance, which is honestly pretty rare, you usually need a diagnosis of infertility. And unfortunately for many insurance providers, they wouldn't consider a same-sex couple as that medical diagnosis yet. Hopefully that will change in the future. But it's always worth checking. Sometimes you may have some other benefits like family law benefits that could be applied to the legal costs. Once you know the total cost, we actually have a searchable grant and discount database that you can look through and filter. It's one of the largest ones out there. So if you're a same-sex couple or a military worker, you can filter for all of that. And we always advise asking friends and family. People are typically surprised that future grandma or grandpa might be interested in contributing a good amount too. If you do need a loan, though, I'll talk about that next. So before we dive in, there's a couple pillars that we like to encourage people to kind of think about as they're making the decision of when to start. If you don't have all the cash available right now, it can be tempting to kind of wait and save up. But I do want to flag, we have historically seen fertility costs go up pretty dramatically every year. I've been in the industry now for many years. And so if you're able to sign that agreement with Hatch or get started now, you will likely be locking in much lower prices than if you do wait. And this is kind of a balancing act with interest rates. So obviously in the middle column here, interest rates are at an all-time high. They've just gone up dramatically over the last few years. So while there are loans that start as low as under 7%, the average kind of personal loan, even for a pretty prime borrower that we're seeing, is more like 12 to 15% APR, which is a lot. But if you take into account the fact that fertility and surrogacy costs go up by anywhere from 5 to 15% a year, it may actually be worthwhile to start off the process today, even with that higher interest loan. And I'll also add, we hope that interest rates might come down this year, but when you're taking out a loan, just make sure that you don't have an early prepayment penalty. You can always kind of hedge by taking out a loan today. And then if interest rates do go up further, you're locked into that fixed rate. And if they do come down, if you don't have a prepayment penalty, you can always refinance. So that's a really useful tool. And I'll talk a little bit more about some of the strategy in applying for financing. And the third factor that people often consider is their own biology. So I'm definitely not a doctor. This is a good place to talk to your medical team. But if you are trying to create your own embryos, often getting started sooner rather than later, again, even if you do need a loan, can help, just because we know that for most people, the sooner you start, you would get more and higher quality embryos and perhaps need less IVF cycles to get to where you want to go with your dream family. All right, so your financial toolkit, like I said, if you do need to sit down with one of our financial advocates to go through this in a lot more detail, we're happy to help you. When you look through your employer benefits or insurance benefits, definitely think of yourself as an advocate. This is kind of a new space, and more we're seeing companies add these benefits just because people ask. We'll go through all of these with you if you need help, or again, you can review our website. And then if you need other resources, there's actually a whole suite of different financial tools you can use when you think financing. So I did mention we have this searchable grant and discount database. We also allow people to set up a baby savings account if you want to start putting money aside in a separate account for your surrogacy journey and future family. Sunfish makes it really easy to do that. And we have a few different types of loans. So when you're borrowing, you can either borrow a secured or unsecured loan. Secured loans have some sort of collateral, and the interest rates tend to be a little bit lower. So through Sunfish, we have a searchable loan marketplace on our website. You can borrow against a 401k or a HELOC, which uses equity in your home, or you can take out an unsecured loan. And the interest rate's going to differ based on those pieces, but it's actually free and there's no ping to your credit score, just to check your rates and see all of those different options. So if you're wanting to come to our grant discount database, just go to joinsunfish.com, click on Afford, and there's that resource right there that's free to search. That covers a lot of different demographics, including marital status, income, profession, etc. And lastly, if you do need a loan, so we designed Sunfish. I'm one of the founders, having worked in the fertility industry for many years, and specifically with surrogacy. We found that it was really frustrating for our intended parents and the people that I was supporting. I've worked with thousands of intended parents now, to go to all these different platforms and try to find the right loan for them. Greg talked a little bit about how many moving pieces there are to this journey. So we designed Sunfish specifically to help people going through surrogacy and IVF by offering a loan marketplace. It's the most comprehensive marketplace that I'm aware of, where you will simultaneously be searching across all these different loan options that I mentioned: secured, unsecured, super prime down to subprime. We offer a varying loan amount up to $100,000, although I would always recommend to apply for less than 50,000 to start. That's where a lot of lenders do cap their amounts, and that's where we see the highest approvals. And you'll get presented a number of different offers that you can then click through and apply for. You can also add a co-signer as well. So a couple strategic tips if you do need financing, definitely applying. Yeah, you can go to the next page. Applying for the smallest loan possible will be the best way to start, and the shortest term as well. So instead of like a 5-year term, you could apply for 3 or 2-year term if you think you can handle those monthly payments. Those are the things that are going to bring down your interest rate the most. And so 3 other tips here. If you do need a loan, you do need to be a permanent US resident. Unfortunately, we can't lend to people residing outside of the US, and that's not just Sunfish. I don't know of any lender that can offer loans for this journey type if you're not residing here. You don't have to have perfect credit, although it certainly can't hurt. But if you're worried about your credit, consider a co-signer or a co-applicant. And then really make sure you understand all the fees. So at Sunfish, we don't have an application fee. There's no prepayment penalties, but there are other lenders out there that will charge that or charge an origination fee. So I would just read the fine print, make sure you know what you're getting yourself into. I've had some really frustrated intended parents come to me after paying an application fee, for example, and realizing that they didn't actually qualify, which is not fun at all. So definitely read that fine print. If you want to learn more, we have a special page for Hatch intended parents. It's just joinsunfish.com/hatch, or you can visit us on Instagram, TikTok, Facebook, all at joinsunfish.com. So I think those are the main points. I'm really excited to help, and I know our team would be really excited to help you. Many of us have had our own personal journeys with fertility. I've had my own egg retrievals, and we have others who are parents through surrogacy. So we'd be really honored and excited to support anyone working with Hatch.
Thank you so much, Angela. And this is just if you guys want to learn more either about Hatch or PFCLA fertility there on the bottom right, or would like to speak with Yale about a journey with Hatch or PFCLA or both, you can scan that QR code with your phone. Remember when that became a thing during the pandemic? Now it's all QR codes. So you can do that and schedule a time with Yale. But with that, we can take some questions from those that are here from our participants. So if you're going to have a question, maybe type it into the Q&A section, and I'll coordinate that in between Angela and I, and we can answer it. So I get that message from Trey, but we'll certainly reach out to you, Trey. Anybody else have questions?
One thing I often do get asked is, when should I apply for financing in the journey? Like, how do I kind of get started with financially preparing? So I always advise as soon as possible. Again, it doesn't impact your credit score to just check your rates and see what you're qualified for. It's great to start that at the beginning of the journey. You don't have to actually withdraw the loan right away, but at least you'll have that information ready as you start the planning. If you do need a loan, you can get your funding in as little as 72 hours. So start planning early, and then you can always wait to actually take out the funds later.
Yeah, that's a great tip. Yeah, you can always figure out, again, it's part of making the spreadsheet, right? Figuring out what you can borrow and all that. One of the attendees mentioned the uterine lining testing and mock cycles that we do through the surrogates. So let me just talk a little bit about how we got there. So we looked at our 2023 surrogacies, and we found that the rematch rate we had was 25%, which is pretty consistent with the industry. And of that 25%, about 17% of the 25% were due to uterine lining disqualifications at the first stage post-match, which was medical screening. And a large chunk of those were due to women who had had IUDs as birth control method prior to having them removed. So any doctors out there, you should probably look at this whole IUD thing because it's causing some fertility challenges in the United States. So as a result of that, we saw how, that was making our intended parents upset, and it's standard. I mean, that's all agencies are experiencing this. It's not just us, and it has been going up over time. And so we devised this idea that because we have a partner clinic with PFCLA, that since our medical director is effectively the surrogate's doctor, that we could actually issue orders to have all of our surrogates in the last stage of our screening process go to a local radiology facility or an IVF facility to go through a uterine lining check, which basically means we want to see a uterine lining of 7 millimeters or greater for surrogacy. And so if they have a traditional form of birth control, like birth control pill, or none, we have them go and just do a standard lining check to see if that checks out. And then if they're on an IUD, that had an IUD removed, we wait for a couple periods and then have them undertake a mock cycle, which is effectively 3 weeks of just a pill that they take, which sort of simulates what they would do during a normal transfer cycle, just to make sure that the uterine lining thickens up through that process post-IUD to be acceptable for an IVF doctor for transfer. And so we are finding that we are disqualifying a lot of surrogates in the screening process for that, but now we know that once they get to match, once you meet them through Hatch, that these are the most medically qualified surrogates on the planet because they've gone through that process. And then the DQs you should see after that would really just be due to like a miscarriage or multiple failed transfers. And so that's always going to happen in the process, but at least we've controlled for that. And I think that partnership with PFCLA has enabled that. And a lot of agencies are going to be very hard challenged to replicate that. And so we think it's a great thing for intended parents. It definitely also is great for our surrogates who don't get their hopes up after meeting a set of intended parents and then have to go and get DQ'd immediately. So that's how we do it there. And it's, again, this is a recent thing we did a few months ago, and we're already seeing a lot of benefit from that.
I'll just add, I think that makes a ton of sense. Like, once you get matched, you want to know that you can move forward quickly, and doing that screening afterwards can really slow down the process. So I think that's a really great addition to the process for Hatch.
Yeah, and last thing is like because of this IUD challenge, most doctors would have to wait like 4 periods after an IUD removal to even start screening a surrogate. Now we do it after 2 periods. We do the mock cycle, and so we can match people quicker with these IUDs. And so it's just been overall a great change to our process. Zephaniah wants to do a consultation. Well, great. You can reach out to us and we can do a consultations. So another question from someone else that says, for foreigners who are in the US and are legally authorized to work, but not yet a permanent resident, is there any opportunity for a loan? Angela?
There might be, I don't know if you have a social security number already in hand. Feel free to email us or reach out to us. Our customer support team is paige@joinsunfish.com, or just go to joinsunfish.com/hatch. So there might be, I can't quite answer that specifically.
Yeah, I mean, that's obviously a challenge a little bit. And you know, you do need a credit history of some kind usually to get a loan. And so it can be challenging for folks who've been here for a short period of time, even if you have all that, right?
That's exactly right.
That's
Yeah.
how it works. Any other questions anybody wants? We're at the end of the list. And so, of course, we can talk to you guys more in detail one-on-one in a consultation. Again, you can reach out to Yale. We'll send around the presentation to all the attendees so you guys have all the information that was in there, including how to reach out to Sunfish and how to reach out to Hatch. And I'll do going once and going twice. All right, I think that then is it. Well, thank you everyone so much for your time today. I hope this was informative for you, and we hope to see you at some point in the future. Thanks so much, everyone.
Thank you.
Thanks all. Bye.